Hypothalamic vasopressin-producing tumors, often inappropriate diuresis but occasionally Cushing disease. By ASA, Sylvia L., Ezzat, Shereen, Kelly, Daniel F., Cohan, Pejman, Takasumi, Yuki, Barkhoudarian, Garni, Heaney, Anthony P., Ridout, Rowena, Chik, Constance L., Thompson, Lester Dr., Gentili, Fred, Mete, Ozgur via the American Journal of Surgical Pathology, published ahead of print. Tumors of hypothalamic neurons that produce vasopressin are rare. We retrieved all cases of vasopressin-positive tumors in the cellular region from the database of the Department of Pathology. 5 cases fulfilled the selection criteria, representing the first series of such tumors. Clinical, radiologic, and pathologic features were reviewed. 4 tumors classified as neurocetomas were identified in 3 females and 1 male patient. The ages at onset of symptoms ranged from 17 to 40 years. All were large ciliar masses with supraciliar extension and/or invasion of the paraciliar sinuses. 3 patients had the syndrome of inappropriate antidiuresis. In one of these, a 6-year history was initially considered to be idiopathic. 1 patient died of progressive disease, 3 had incomplete resections and are being followed. In contrast to these patients with neurocetoma, a 65-year-old woman had Cushing disease and a 0.8 cm mass that was completely resected at transsphenoidal surgery. This tumor was a gangliocetoma-producing vasopressin associated with corticotroph hyperplasia. We postulate that the small amount of vasopressin secreted by this mature gangliocytic tumor was locally bound to corticotrophs, resulting in hyperplasia and Cushing disease, without sufficient overproduction to cause systemic effects of vasopressin excess. Hypothalamic neurocetoma is a tumor that can mimic pituitary neuroendocrine tumors and olfactory neuroblastoma but is distinguished by positivity for neurofilaments, none, and TTF1 and negative staining for adenohypophyseal biomarkers. Our cases illustrate that neurocetoma and gangliocetoma are 2 variants of tumors of hypothalamic neurons that spectrum. Their function also can result in divergent clinical manifestations, one characterized by a reduced urine output and the other by the more insidious features of glucocorticoid excess. Conflicts of interest and source of funding. The authors have disclosed that they have no significant relationships with, or financial interest in, any commercial companies pertaining to this article. Correspondence: Sylvia L. ASA, MD, PhD, Department of Pathology, University Health Network, Laboratory Medicine, and Pathobiology, University of Toronto, 200 Elizabeth Street, 11th floor, Toronto, Ontario, Canada M5G2S3, email G2S3, email, sylvia.asa@utoronto.ca. Copyright 2018 Wolters Kluwer Health Incorporated, all rights reserved.